when I think of Tom Bodenheimer's 10 building blocks, I think when you look at each of those 10 blocks, it's almost like not that you have to do every one, but you have to do almost pieces of each one if you're really going to transform. Now, when you look at individual ones, again, I'm going to look at the paper here. Just the first one is engaged leadership, which we talked about earlier, that I think you have to have physician leadership setting the tone for this transformation. He mentions the empanelment of patients. I mean, you have to know who your patient population is if you're going to manage them. So I think that if you're going to manage a population, you've got to know who they are, and that comes with an empanelment and knowing who your patients are. The data-driven part, I think, has been so key in our transformation that you have to have data on your population in an actionable way if you're really going to be able to move the needle on health of a population. He talks a lot about team-based care, which also we found is invaluable in practice transformation. That piece of engagement of your workforce, empowerment of that workforce, even energizing that workforce to make sure that everyone feels like they're having an impact on the care of patients. We've also mentioned access, which he refers to. Access is key if you want to manage a population, being available to your patients, at, whether it's electronically, in person. You have to have the different points of entry into your practice if you're going to maintain that patient engagement. And I think the last one I'll mention is the comprehensiveness. And that comprehensiveness can be, as I mentioned earlier, in the context of the care we provide as an individual physician and the expertise that resides in your practice, so the patients feel like they can come to your practice for the majority of their healthcare needs. And obviously, surrounding that, so a trusted group of subspecialists, which we mentioned, that is so key in not only good quality care, but cost-effective care.